I'm delighted to have the opportunity to describe our study. It was a systematic review and meta-analysis that addressed within a conceptual framework disparities in utilization of arthroplasty between Black and white patients. It's been observed for years that Black patients with similar degrees of arthritis, similar severity of arthritis, are less likely to undergo arthroplasty. And in fact, a much lower proportion of Black patients with advanced arthritis seek arthroplasty. Arthroplasty is known to be a highly effective treatment. So we were and remain a little confused as to why a large segment of the population isn't seeking help in this fashion. We defined a conceptual framework that consisted of patient characteristics, social factors, cultural characteristics, and arthroplasty outcomes. And we performed a systematic literature review to try and better understand these disparities between Black and white patients in arthroplasty use in the context of our conceptual framework. What we found with this study was that there were significant differences in the importance that Black patients attributed to arthroplasty compared to white peers. And specifically, we found that outcomes were worse for Black patients. There tended to be more complications, longer lengths of stay, fewer outpatient procedures, and more emergency department visits after the surgery. So there were structural differences. We weren't able to really understand what the social factors were that led to those barriers, nor did we come out with real solutions, although we were able to understand some of those factors that seemed to contribute to the discrepancy, the disparities in utilization of arthroplasty.